Hey everyone, welcome back to the NPA podcast. This is episode number 4, and we're so excited to have you here. And today we will be interviewing Dr. Joan Miravite. Welcome, Dr. Joan.
Hi, nice to be here. Thank you for inviting me.
Oh my goodness, we're so excited that you're here. I'm going to read a little bio about you because it is a very impressive bio. I want everyone to pay attention. So Dr. Joan Miravite is the co-chair of the Jonas Foundation Alumni Council. The Jonas Foundation provides scholarships to doctoral nursing students. She received a scholarship which helped her to complete her doctorate in nursing practice at NYU. And as a result, she started working with the Jonas Foundation and is now the co-chair of the Jonas Alumni Council, where she works in partnership with APPs nationally on mentorship, recruitment, and networking. As a woman and Asian American serving as the chair-elect for the American Academy of Neurology, AAN, Consortium of Neurology Advanced Practice Providers, she's a role model for other APPs. Her role is to mentor, recruit, and educate APPs to elevate our role in neurology. She is charged with identifying and promoting current programming, as well as developing new opportunities within the organization that will meet the needs of APPs throughout their careers. Her plan is that once she transitions to chair and gain a seat on the AN Medical Economics and Practice Committee, she plans to she'll be strategically positioned to represent all APPs in neurology nationally, advocating for acceptance of the APP role in the care of neurological disorders and for more autonomy in clinical practice. In this role, she hopes to champion the neurology APP community. If this wasn't enough, she's also the Assistant Professor of Neurology at the Icahn School of Medicine, Adjunct Professor at NYU Rory Meyers College of Nursing, where she teaches a graduate nursing course called Issues and Trends in Healthcare Systems, and a Clinical Instructor at Columbia University, where she's been precepting NP students from her alma mater for many years. In case you thought I was done, I am not. She is also core faculty for the Parkinson's Foundation Team Training Program, an international multidisciplinary training program for clinicians. She is the sole nurse practitioner core faculty member of 9 clinicians, developing evidence-based content focused on the patient-centered care practice model. She has trained over 500 students in this program, empowering them to build their own teams and programs. She is also one of 7 invited members of the Parkinson's Foundation CVS Project Planning Committee, where she works to improve the treatment and outcomes for patients with Parkinson's disease who lack access to neurological care or specialists. Welcome, Dr. Joan.
Thank you so much.
Of course. Can you tell us how you started your journey in healthcare?
So I was actually a bio major, and when I finished my bio degree, I didn't really know what I wanted to do towards the end. But my aunt, who was a nurse, I come from a long line of nurses in my family. So my mom was a nurse, her sisters were nurses. And so my aunt was working at Sloan Kettering, and this was back in 1995. She told me about this new thing called a nurse practitioner, where there were nurses with master's degrees who were writing prescriptions and really caring for patients in the hospital, and who were autonomous. And that was her word. She said they were autonomous. They could do things on their own and write orders and take care of patients on their own. And they were very well respected, she said. And she thought I would be really good at it. So I applied, and I got into the Columbia program. And but before I could start, I had some time lapse before I could start my program. I became a nurse's aide for 9 months, and just to get my feet wet and really understand what nursing was all about. And I loved it. And then I went to school. I became an RN, and I started working on a neurology neurosurgery floor, which is why I applied for an NP job in neurology, and I had no idea what I was getting myself into. I just had an inkling of what neurology was, but I didn't really know what I was getting myself into when I applied for a job in movement disorders. But I'm really thankful and that I love my job, and it's been really a great transition for me. After 15 years, I went on to get my doctorate degree. So and after I got my DNP, my career has, I feel like, exploded. So I'm teaching, I'm presenting at national conferences, and it's been very busy lately. So
Well, clearly your aunt was right in steering you in this direction. And that is amazing. And if I could ask you, how did you get involved with the NPA?
So I actually got on the phone with Stephen Ferrara years ago, and I asked him about becoming a fellow for the American Academy of American Association of Nurse Practitioners. He's like, first you have to do stuff for me. So he asked me. So I joined the NPA so that I could work more with the NPA and teach people about what I do. So he asked me to present uh, a talk about movement disorders for the non-neuro specialist. So
Mm-hmm.
which was great because it was the first time I was speaking there, and this was back in 2016. And I was hoping that I had my fingers crossed that there would be more than 2 people in the audience, and it was standing room only because
Wow, that's
it was
impressive.
so it was really it was great. So I feel like I can really help people, and you know seeing these patients can be scary sometimes. So if you don't know what you're looking at, and that's my goal is to really lessen that anxiety about what you're looking at. So
And that's so needed. It's so needed in primary care. It's so needed. It's, if providers, right, are nervous in managing patients, they're not going to approach it correctly. So you providing that comfort level is so critical for providers. So thank you for doing that.
thank you.
What are some of the, and I know that you've seen so much, right? Because in just the amount of time that we've been NPs, what are some of the changes that you've seen in the NP world?
So just recently, the full practice authority for New York State has been
Yes.
really exciting. And what I've seen also recently in your own practice, NP run owned practices in New York State has been really amazing. So, kudos to you for that. I always wanted to talk to you about doing that. And I think that more and more we're more autonomous. When I first started, it was not like this. So it's been great to see the progression. And,
Absolutely. Well, it's thanks to providers like you that pave the way when people realize how amazing APPs are. So thank you for doing that. What
thank
advice would you give to any recent graduates from an NP program right now?
So, my advice to new graduates would be to keep an open mind. When I applied for a job, I had I didn't really have any specific direction I wanted to go in. I didn't know I would end up in neurology, but I applied anyway because that was where I was working as a nurse. And, I'm really, really happy that I did that. If someone had told me 25 years ago that I would be working in movement disorders and programming deep brain stimulators, I would have told them that they were crazy. So, but that's what I do, and it's my favorite thing to do. So I'm really happy that I wasn't afraid, and I just, I promised myself I would try and see if I liked it, and I haven't left. I've been working in movement disorders for 21 years. Another thing I would say is that to a new grad would be, don't be afraid to ask. Ask questions, ask for help, ask for advice. So, for example, my doctoral project was to educate caregivers of hospice patients about what to expect at the end of life, and my project was to create a video, but I had no idea how to create a video. And so I reached out to the dean of NYU Film School and asked for help, and he responded right away. And he didn't have to; he could have just ignored my email. But I asked, and he helped me. So don't be afraid to ask for things. And the last thing is that you will bring something unique to your own practice. And so, whatever it is that you like to do, you should continue to do that and help it flourish.
I love that. So it sounds like jump in, even if you're not ready, then
Yeah.
ask for help and know that you're bringing something to the table.
Yeah.
Even if you don't feel like you are, you are. That is great advice. It really is. And clearly, based on the bio I just read, that system has worked for you. I love that. I really just want to thank you so much for your time, for being here. And I look forward to getting to know you off camera. And to everyone listening, Dr. Joan is amazing. And be empowered that wherever you are in your journey, whatever role you're taking is really important for all of us. Thank you so much for your time.
Thank you.
Thank you. I hope you enjoyed today's podcast. Tune in next podcast number 5. And don't forget to follow us. Follow the NPA on Instagram, Facebook, YouTube, Spotify, everywhere. We look forward to seeing you.